The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe that we are celebrating our 10th anniversary of the Health Matters radio program. We are planning some special shows to celebrate the milestone, and so we hope you'll stay tuned. Let's begin today by thanking our sponsors, Studio Arts and Glass, Cleveland Clinic Mercy Hospital, and of course our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dan Lane, Doctor of Nursing Practice and Quality and Risk Management Director at Cleveland Clinic Mercy Hospital. Good morning, Dan, and welcome to the show.
Good morning, Paul. Good morning, Brad. How are you this morning?
Doing good.
Great.
Okay, March 14th to 20th this week is National Patient Safety Awareness Week. This is an annual recognition event intended to encourage everyone to learn more about healthcare and patient safety for both patients and the workforce. Real progress has been made in patient safety over the last 2 decades, yet preventing harm in healthcare settings remains a public health concern. Everyone interacts with the healthcare system at some point in life, and everyone has a role to play in advancing safe healthcare. This morning, we're going to talk with Dan and discuss tips for both healthcare safety in our homes and in the healthcare system. We'd like to remind our listeners today that our program is available on our podcast. You can download it from the App Store on your mobile phone. Please subscribe. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
So good morning, Dan, again, and please tell us a little bit about yourself and your role at Cleveland Clinic Mercy Hospital.
Sir,
And
good morning. So I'm currently the Director of Quality and Risk Management here at Cleveland Clinic Mercy Hospital. I have to stop myself and not say Mercy Medical Center anymore. We're, I think, at a day 28 and 19 or whatever is a new entity. So it's exciting here to be here during this time. I think the community is really going to appreciate the Cleveland Clinic being here and all the resources they're going to offer. I've been here for almost 10 years, and I've been nursed for over twice that long. I'm a lifelong resident of Stark County with my wife and 3 daughters.
so we're talking about patient safety today. How does the COVID pandemic play into patient safety?
It really does. And we know the COVID pandemic weighs heavily on everyone's minds right now. You may wonder if it's safe to get care. And yes, the hospitals are among the safest places in healthcare today. You really should feel confident that we're keeping your family and our caregivers safe. No matter what brings you in, know that we're taking steps every single day to keep you safe during your appointment, procedure, or surgery. Some of the steps we've taken to increase safety at our family health centers, our emergency rooms, and our hospital, and we've made a few changes to make our hospital a safe place for patients, visitors, and caregivers, including we've limited visitors, we're encouraging physical distancing, disinfecting common areas frequently, and requiring masks of all visitors, patients, and caregivers.
You know, all I hear from people is, I don't want to go to the hospital. I'm afraid to go to the hospital because there's sickness in the hospital. What do we do here?
I know. You know, and it's a valid concern, but you have to know that it's just as safe to come to the hospital as anywhere else in the community. Our testing is a much better supply than we were at this time last year. So we're able to test every inpatient, everyone coming to surgery. We're able to test those patients quite before any procedure. As we've been saying, you wash up, mask up, and back up. So you make sure you perform good hand hygiene. You make sure you're wearing your mask at all times, and you have that physical distancing to keep you apart from other people. In the hospital, we have screening stations where all visitors are screened for signs and symptoms of COVID. Everyone's given a mask to wear. All employees wear masks. We've created social distance in areas like our cafeteria and our waiting rooms. So our employees screen themselves every day before coming to work. We have more frequent cleaning of high-touch surfaces. And we've created virtual meetings just like this. So all our meetings now are this all day instead of getting into big rooms together. And we've had to adjust like staff lunch schedules. We realized quite early on that staff lunches were a cause for concern for the spread of the virus. So we had to better separate our staff during the times to help keep them safe. Because, when you're eating lunch, you're not wearing a mask, and we had a potential there. So we had to adjust our own lunches to make sure that we're keeping each other safe as well.
So you just sort of listed some things that we can do to keep ourselves healthy during this COVID pandemic. Any additional things that people out in this public and that sort of thing?
Be aware of your surroundings. I want to tell people get outside when you can, though. I don't want you to be cooped up in your house, and I think that really creates a lot of issues. But get outside. Socially distance outside, but get outside. Take a walk and get some exercise. And monitor yourself for signs and symptoms of COVID. Look for a fever, a new cough, tiredness, shortness of breath, a loss of taste or smell, headache, a runny nose, or sore throat. And if you're not having those symptoms, it's okay to socially distance around other people. And you do have to have that interaction with people at some sort. So make sure that you're doing that. Either, we've all learned how to use an iPad, FaceTime, talk from each other's porches. But I really encourage people just to get out and walk the neighborhood safely, but get outside and still do stuff.
All right, so as I mentioned in the introduction, this is National Patient Safety Awareness Week. What can you tell us about the focus on patient safety?
Well, Patient Safety Awareness Week is an annual recognition event intended to encourage everyone to learn more about patient care health safety. During this week, hospitals seek to advance important discussions and inspire action to improve the safety of the healthcare system for patients and the workforce. It serves as a dedicated time and platform for growing awareness about patient safety and recognizing the work already being done. I want to say Patient Safety Day is every day because we always want to do our best to create a safe environment for our patients. Our new president, in the last couple of weeks, he created a new slogan, Park Like the President. So if you have a good safety catch, a good catch here in the hospital, you get to have his parking spot for a week. So how great is that Dr. Crone's willing to give up his parking spot? And it's a primo spot, let me tell you, to any caregiver that has a good catch for a patient. So that's our mentality, and we want to make sure that happens every day, just not this week.
I like it. What can patients and family members of patients do to improve their safety within the healthcare environment?
You really, to ensure a safer experience with the healthcare system, you need to be involved and informed about your treatment. So you need to ask questions, and you need to follow through on the clinician's treatment and instructions. The patients can take part in that process and gain confidence in the system. Improving patient safety requires continuous learning and the constant communication between your caregivers, your organization, and each other, your family, and so everyone knows what's going on. I think that communication piece is the biggest piece about having patient safety. So everyone has a role in patient safety, and you'll benefit from that success.
Okay. So you already did it in the beginning of the program, but we can't stress hand washing enough. Can you describe why hand washing is so important, and especially within the hospital environment?
Right. So, there's nothing like a pandemic to increase the hand hygiene rates in a hospital. So we actually have the Ohio Hospital Association monitor our rates every month. They come in and do a secret shopper, and they watch our caregivers perform hand hygiene. And I'm so happy to see that our caregivers are doing an excellent job of making sure that those hands are they follow the 5 steps of hand hygiene. But practicing good hand hygiene is also a simple yet effective way to prevent infections. As a patient in a healthcare setting, you're at risk to get infection while you're being treated for something else. So patients or loved ones, it's okay to ask and remind a healthcare provider to clean their hands. Everyone's busy. Everyone's running around from room to room sometimes. And you might see someone forget to do hand hygiene. It's okay to stop and say, hey, I would really appreciate it if you could wash your hands before you touch me. And that just not goes for the staff, it also goes for the patient. So patients also need to practice good hand hygiene by cleaning their hands before eating, touching your face, dressing changes, after the restroom, or after blowing your nose, coughing, or sneezing. It's just all around good practice. And I think we're seeing a benefit of that. Our flu rates, our influenza rates are probably the lowest we've ever had in the state of Ohio right now, with everyone performing hand hygiene and wearing masks. So it does work.
Well, I'd be remiss if I didn't mention some patient safety activities that we do in the pharmacy. So As a community pharmacist, we also focus on this. During the process of completing a prescription, there's many extra checks that ensure your safety. These include steps like checking for allergies to the medications prescribed based on your medical record, making sure there's no potential for adverse reactions between the medications you've been prescribed, counseling patients to make sure they understand their medications, what they're for, how to take them, how to store them, what foods or beverages might interact with them. And finally, we like to make sure that you receive the correct medication at the prescribed dose and the correct directions on the label. Medications are really only as good and as effective if the patient takes them as directed and communicates with both their pharmacist and their provider. So we try to encourage communication and questions. There's no dumb questions. You've always heard that. There's no stupid questions. So ask questions if you have them. It's important that you understand why you're taking a medication. And Dan, can you comment on the steps a patient should follow in a hospital setting related to medications?
They're really the same steps, and I had that wrote. Know your medications and have an accurate medication list. I've worked in a hospital almost all my life, and I've seen plenty of patients say, "Well, I take that little white pill right before dinner," which really doesn't help anybody. But what I'm talking about. So make sure you have an updated list, and keep that updated. And maybe give a copy to a child or a relative, so that way if you can't get to it, someone else can get that list for you. Ask your caregiver questions about your medications. Ask your doctors, ask your nurses. When you come to the hospital, we have so many substitutions because of generic drugs and stuff like that. So maybe you take one item, but we have a generic substitution as another item, and you don't recognize that medication. It's okay to stop and ask, what's this medication for, and how does it go back to what medication I usually take? And then sometimes because you're here, a physician will decide that we shouldn't be giving you that medication right now, and so they're going to stop that. And it's okay to ask, hey, I usually take this medication every day. Why aren't I? So it's very important, and I think you have to be an active participant in your healthcare and your medications, and also know what each medication is for and the common side effects of those medications as well.
From a pharmacy perspective, a critical piece of patient care is having a relationship with your pharmacist. That means only having your prescriptions filled at one pharmacy and knowing your pharmacist by name. That allows your pharmacist to be aware of your health conditions, have a complete list of all the medications you're taking so they can be aware of your whole system and what interactions you might have. Your pharmacist and physician are a team working together to provide the best possible care. Dan, can you comment on the importance of having a primary care physician and how that impacts safety and health?
Yeah, having a PCP or primary care provider is so essential in today's world. They manage your day-to-day health needs. A long-term relationship with a PCP helps keep you healthier and lowers your medical costs. They can teach you ways to stay healthy, treat you when you're sick, and then help you get more advanced care when you need it for a specialty item. Physician. So finding the right PCP does take some time, but it improves your well-being in the long run. Having that long-term relationship, helping you stay healthy and get better when you're sick. And then you're really your partner in sharing the responsibility for physical and mental health and well-being. They know you. When you have a relationship with them, they know you. So, they know your current history. They know your medical history. They know your family medical history. And they know your treatment preferences and daily challenges. And they know your personality and lifestyle. I've had my PCP for over 20 years, so he knows my 3 kids, so he's always asking about those. He wants to know how my wife is doing. What stressors do I have at work? How's work going? So when I see him at work, here around the hospital, he's like, "Wow, what's going on now?" So we always have something to chat about in the office. But it's really important to have that camaraderie with a physician that you can trust, and then have that relationship with, and that just leads to a better lifestyle, a healthier you as well.
I think we should take a break here. Dan, you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Lots of new stuff at the Half Off and Hot Buy store in Louisville. Just in, L'Oreal No. 7, lots of health and beauty products, plus hundreds of watches, barbecues and lawnmowers, all at the half-off prices. We continue to add new inventory to get ready for spring and summer. Lots of ready-made Easter baskets await you, and not all totally candy-filled, but toys also in the baskets. Stop by, take a look at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center Pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing patient safety with Dan Lane from Cleveland Clinic Mercy Hospital.
All right, Dan, more than 700 medications that formerly required a prescription are now available over the counter. These medications are not without risk and can cause problems if not taken correctly. Dan, let's talk about a few common over-the-counter products and highlight some of the issues and risks that our listeners should be aware of. So how about Tylenol or acetaminophen?
It's confusing for consumers. There's multiple brands, there's multiple names, and there's all different dosages out there. 325, 500. Probably there'll be something out before we know it, some other dosage next. But it's really important to follow the dosing directions on the side of the box, and watch about taking multiple medications with the same ingredient. You don't want to mix NyQuil and Tylenol together because there's already usually Tylenol in the NyQuil. So having too much Tylenol can cause liver damage. So I think we want to keep that around under 3,000 milligrams per day.
Yeah, and I guess I'd just comment that I like to use the analogy that when you walk into the big box store and you see aisles and aisles of cough and cold or pain medication, you know what? Our listeners need to understand that there's really only about maybe a half a dozen different active ingredients in those oceans of products on the shelves. So it's another really good reason to talk to your pharmacist and know your pharmacist and ask them what you need based on the symptoms you have so that you're not taking those multiple products that could actually do more harm than good. So while they don't require a prescription, you need to respect what's on the shelf, and because it can hurt you So be safe and ask questions, again, like we're talking about today.
Right. I mean, you have to be an active participant. So if you have a question about something and what it's for, I mean, it's great to have that pharmacist right there in your community store to help you out. I always look at duplication, opposition, and alteration. Some of those medications interact with each other, and you can't take that with your prescribed medications. In that big box store, that pharmacist there is not going to know your medication. So when that pharmacist in your store knows that what medications you're already on, they say, hey, you can't take that over-the-counter medication because that might affect your blood pressure pill. That's huge for patient safety.
In the last few years, one of the products that's come off of prescription is the steroid nasal sprays. And so many people are I can't do that. I can't use a nasal spray. Heck, I was raised on nose drops when you got sick because you had nothing else, and some aspirin and stuff like that. But that really is a wonderful product, if not abused, and can really help a lot with sinus congestion and nasal inflammation and all that, as opposed to taking a raft of pills. So it's interesting in the people that I talk to, that I suggest this product to, the steroid nasal sprays. Oh, I can't do that. I've never done that before. And it is kind of interesting because I believe that is a great solution, to nasal congestion and inflammation and stuff, as opposed to taking a bunch of pills, So how do we cross that barrier?
That's hard, and I remember those first came out as a prescription, even, and it was even hard to get your insurer to even pay for those. You had to jump through hoops to get them done, and now it's over the counter on the shelf. You can pick whatever one you want.
Sure. So anyway, I think that really is, as Brad said, there's about 6 items on the shelf, and there's several hundred different products on the shelf, and I do think in the last few years this is one of the rather very useful products that was removed from prescription level over to nasal, over-the-counter usage. So somehow I got off on that. Sorry. But I hope people are listening and can try it when they get head congestion or whatever.
It's almost allergy season. We're going to need that pretty soon.
I got you. We are just about there.
We sure are.
Just about. So what about patient falls, both in the hospital and at home? And do you have any recommendations to minimize falling? And people, and like Brad was telling me the other day, or told us once on the radio program, that people think that's normal. They're older, and they think, okay, well, I fell today, but that's okay, I'm older. It's not normal.
It's not normal, and it's a big issue. So when you're in the hospital, you really need to use your call light and get up with assistance. People get confused in the middle of the night. They forget they're in the hospital. I can't tell you how many times I've seen that. They might not have fallen, but I hear commotion in the room. When I was a staff nurse and I go in there, they're like, "Where am I? What's going on?" Because they forgot they're even in the hospital. So thinking that they're home, they do get up and they're trying to find their way around the room. They know their bedroom at home, and they know where everything's at, but in the hospital, it's not the same.
Sure.
So they might trip over something and fall. Or they forget they had that IV tubing or the oxygen tubing, and they're strangling themselves at the side of the bed. And you're like, hey, be careful now. You have to kind of reorient them real quick. Once you probably turn the light, you're usually pretty good. But then you also have to make sure you have some non-skid footwear too. We don't have those nice carpeted floors like you do at home usually. So they can be a little slippery once in a while. So it's really important to have non-skid footwear. Yeah. At home, they really need to be physically active.
Sure.
That's the number one way to prevent falls is to stay active. Have your eyes and hearing checked regularly, because you need to have your vision to prevent falls, and that hearing also works with that, to make sure that you stay safe. You need to stand up slowly to avoid dizziness. And to me, it's okay to use a cane or walker if you need assistance for balance. I'm the number one wimp, so I'd much rather use a walker if I had to than take the chance of falling and hurting myself. Sure. And if you do notice an increase in falls, you need to see your doctor. That's the number one thing right there. You need to get that. You need to see your doctor, and he maybe needs to adjust the medication or forward you on to some specialty services to see what's going on and why you're falling.
Okay, Dan, we got to jump to the news here. It's the bottom of the hour. You're listening to Health Matters with Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Do you have to test for blood glucose? We know test strips can be very expensive at many pharmacies. At the Medicine Center Pharmacies, we supply you with a free Easy Max kit, monitor, and strips to either continue or begin with a new blood glucose monitor. And when you buy a package of 50 strips, they're only $7.99. And only at the Medicine Center Pharmacies you'll find this bargain in Canton, Louisville, Minerva, and New Philadelphia. See us on Facebook for more healthcare bargains.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
You're listening to Health Matters with the Medicine Center Pharmacy. Today we're talking with Dan Lane from the Cleveland Clinic Mercy Hospital about safe medications, over-the-counter products. We have a lot more to cover this morning, so let's get back to the show. One of the interesting questions I think we have today is, I was surprised when a friend of mine mentioned the hospital wouldn't allow chapstick use while on oxygen since it was petroleum-based. And, we've had people over the years, in fact, we had a tenant in one of our buildings who was literally smoking while using oxygen. And it's just, but the petroleum chapstick thing, that kind of caught me off guard. Take a moment and give us the scoop here.
Yeah, so just like oxygen and fire, a petroleum-based product, the three of them are not a good combination because you're having oxygen, fuel, and heat. So patients have suffered second-degree burns from a combination of these three items. So we always recommend that a petroleum-based product, whether it be chapstick, just Vaseline or anything like that, not be used together when you're using oxygen. And I used to work at ED, and I can't tell you how many patients I've seen come in with burns around their nose and face because they were smoking with their oxygen.
It's just amazing. Of all things, we had a situation in one of our properties, and I just thought, how the heck can you not realize the potential, damage or to yourself, whatever, and your property maybe, I don't know. Okay, so a lot of people are postponing important screenings and tests due to concerns, don't want to go to their doctor's office or the hospital or whatever. Why is this an issue, and what impact have these decisions on postponing all this testing do for healthcare?
it's created a backlog, and it's not good. So early detection makes a difference. Routine cancer screenings are still important. Generally, the later the cancer is detected, the more serious and involved the treatment becomes. So catching any kind of disease and cancer at early stage may make for an easier treatment and improved outcomes. And if you're considered high risk, it's especially important for you to stick to a regular screening schedule. I think already the CDC is saying that they're seeing a backlog of potential issues because of the closures last March and April, and we're now just starting to catch up and get those patients back in the system where they feel comfortable being there, and we're going to have some repercussions from a couple years to come with that. But it's important to keep those screenings going and make sure that you're communicating with your doctor and getting those stay up to date.
Do you think that the people have been spooked by the media here? I mean, I know people haven't been out of their house in a year, and I'm thinking just to get the mail. I'm thinking, wait a minute, what is going on here? Go outside or something, walk around the house or whatever. But it kind of makes me, what's going on here?
Yeah, I think there's a little bit of that, and that's why I think I said earlier on, get outside and get some exercise. Even if you just take a walk around your neighborhood, you can still walk with a mask on. If there's a ton of people out, you might social distance, stuff like that. But you need to take care of yourself, and that's really important right now. And part of that is getting outside and getting some exercise and getting some fresh air.
So we have to get to the individuals or the people. You're talking backlogs here. I know there was a tremendous backlog on elective surgery there for a while, and I would guess that that's been pretty well cleared up in the hospitals around the realm. So what do we do to get these people to get in there?
Patients are still worried about COVID, and I think they fear that hospitals are huge super spreaders for the disease. So while we do have patients being cared for COVID in the hospital, it's best that we know that we're limiting these patients to 1 or 2 units. They have their doors closed. They have special air circulation in those rooms, so it keeps the other rooms safe, keeps other areas safe in the hospital. Outside of the rooms, all patients are wearing masks to help stop the potential spread for infection. Hand hygiene is available inside and outside of every patient room. And for our off-sites, we're screening patients for signs and symptoms of COVID at all entrances, as well as our main hospital. And we do expect our patients and our visitors to wear masks to protect each other and our caregivers from any potential spread of COVID while they're here.
I noticed that there is a dialysis center in the back of the hospital. And has this disorder, this corona thing, has disrupted that operation?
That's actually a rented space, so that's not our dialysis center. Okay. So, but I think they had to put their own protocols in place too. So, people can't stop having dialysis. So, I'm sure they had to start spreading out. What most often, like doctors' offices, they had to spread their hours out longer so they didn't have as many patients in at the same time. Create that physical distancing within the department to make sure it was safe for everybody. And that's a real high risk population to begin with. So it's like a double whammy. You got to make sure they have the dialysis, but you got to make sure they stay separated and stay healthy because they're usually on sometimes immunosuppressants. They're on high dose steroids sometimes. So they probably had to do a lot of work there to make sure that everyone stayed safe.
We have so many dialysis centers around the city anymore. I'm really shocked at how many we do have. And so obviously that's a real difficult scenario for all of these people who do require dialysis or home dialysis. I guess is maybe not as big an issue as the in the building dialysis. So. But anyway, I guess that's kind of off subject again. Go ahead, Brad.
All right, Dan, we've talked a little bit about taking care of our physical well-being. What do we need to be mindful of for our emotional well-being? It's certainly clearly important to address mental health concerns like depression and anxiety. What tips do you have for our listeners today?
Well, I always think about this, and my Facebook page is lit up in the last couple of weeks with pictures of my friends seeing their parents for the first time, in like 9 and 12 months. Some of them were in extended care facilities or skilled nursing facilities, and they haven't been able to visit their parents except through, the glass windows and stuff like that. That's not really hard on us as children, but it's been horribly hard on the parents as well they haven't had that contact with their family. And loneliness is really an interesting topic because we're seeing people that are feeling lonely despite the fact that they're home with people they love. So we have to remember that loneliness is subjective, but many times that their whole world is wrapped up in their home, so those people have done really well. My one daughter, she could be in this pandemic forever. She's a homebody. My other daughter, forget it. She's going nuts because she's a people person. She's out there. She wants to see all her friends. I'm I'm going crazy. They're not in my bubble. Don't let them in the house. So you have to balance that somehow, and it's been really hard for a lot of people who need that external support from families and friends they haven't been able to see to be able to take care of themselves with their mental and well-being. So we have to work on that, and I think there's going to be a lot more to come on that as we move forward.
Very interesting.
Okay, so how about this? There's certainly a concern for patients who need emergency medical care for non-COVID related illnesses like heart attacks and strokes. And, I've even had patients in the store say, well, I'm just going to wait a day or two and see if it's okay because I don't want to go to the hospital and be exposed to COVID. And I really think it's important you touch on how important it is about these patients to seek care and not delay it, especially in these severe situations.
Right. So the CDC or the Centers for Disease Control have stated now that 1 out of every 5 people having either a heart attack or a stroke have not come to the emergency department because they're scared of COVID. So 1 out of 5, that's an amazing statistic. So what patients and the public have to remember that the clock starts ticking as soon as that first symptom appears. So the faster a person gets treatment, the greater the chance of not dying or experiencing permanent heart muscle damage that could lead to cardiac or lead to congestive heart failure or cardiac death. Or in the case of stroke, it could lead to lifelong paralysis. So getting quick treatment is still important. And when you're experiencing signs and symptoms of a heart attack or a stroke, you need to call 911. You need to get to the closest emergency room at any time. The COVID is probably much less riskier than stay at home with signs and symptoms of a stroke or a heart attack.
No question. Yeah. So, let's talk about virtual visits. So we know many hospitals and physicians are now offering virtual visits due to COVID-19. What do you think, Dan? Can virtual visits replace all types of face-to-face appointments?
That sounds like the Jetsons, doesn't it?
It does.
It does. But
I'd like the little car.
Yeah, that would be great, wouldn't it? And the dog walker. I think while some routine care can be filled with virtual visits to help you manage your conditions from home, it's also important that not everything can be done online or by telephone. You have vaccinations, you have lab tests, wound care, and other important submitted exams that have to be physically done that you need to be present for by your physician to be seen. Our doctors' offices are also taking great care to screen patients for COVID, taking care of themselves. They're probably wearing face shields and masks and hand hygiene and cleaning everything. They've emptied out their waiting rooms. So a lot of offices, you're waiting in your car till you get texted or something like that. So it's really important to make sure you're maintaining your physician visits and then doing the appropriate visit either virtual or in person. And we're all adjusting. So I think it's important that if your physician feels it's important enough to see you face to face, that you consider an inpatient appointment. If they're calling and you're calling in and they say, hey, we can do a virtual visit for this one, then it's probably okay. But if they really say, hey, we really want to see you in person, I would say get there in person and see that physician face to face.
Do you think that we're ever going to go back to more live physician visits and kind of walk away from what we're doing right now?
I think it's going to be hard. It goes both ways. Some patients really do like being able to do a virtual visit. I don't have to. I could do a virtual visit from my office and not have to leave work for half a day to go see my doctor. For just a maintenance check or just I need my blood pressure medication refilled, you can sometimes just do that with a virtual visit. But other visits will need that doctor. So I think we'll see more of a happy medium somewhere here in the future. But I think virtual visits are here with us to stay.
Okay, let's take our last break here. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White.
Chris Cagini with the Stark County Health Department.
Good morning, Tim. Everyone needs to stay at home, wear their masks. If they have to go out, wash their hands frequently throughout the day, keep that social distance, and you just have to say no to gathering. Everybody is on the front line in this fight now.
Mask up, wash up, and back up.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center pharmacies, we give you at no charge a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin, or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Lots of new stuff at the Half Off and Hot Buy store in Louisville. Just in, L'Oreal No. 7, lots of health and beauty products, plus hundreds of watches, barbecues and lawnmowers, all at the half-off prices. We continue to add new inventory to get ready for spring and summer. Lots of ready-made Easter baskets await you, and not all totally candy-filled, but toys also in the baskets. Stop by, take a look at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to our final portion of the show today, and we appreciate your tuning in. So our guest, Dan Lane, what types of physician visits should a person really do? And I was thinking about this during the break, that basically I think there's two types of patients. Ones who don't really ever tell the doctor the whole deal, okay, and those are the people that really shouldn't be in should be in the office, okay, because they're kind of maybe not telling about their blood pressure or whatever, or the others who go or want to go frequently. So how do we deal with this in this? Sooner or later, we're going to come away from this corona thing, okay, I think, unless they drag it on forever. But how do we deal with this from a healthcare perspective going forward?
It's going to be hard. I mean, it's creating a new chapter in healthcare and how we do things in the United States is for everything. So, we're going to have. I think we're going to have people that are never going to see their doctor and tell them everything that's going on, and they only want to tell them what they think is important. And I think it goes back to that relationship with your PCP, that you need to find one really good physician that you can trust, that you can talk to, and be able to tell them anything that's bothering you. sometimes that's why also people like virtual visits, because they maybe feel the opposite, where they don't want to tell their family doctor that knows them very well everything, but they might say someone on, they might see somebody on the thing and say, I'm having this problem, and feel much more comfortable doing that. I don't recommend that. I think you really need to have that. You need to have that relationship with your physician to be able to move forward.
So let's say the patient just had a successful hospital stay and they're ready for discharge.
Yeah.
What information do you send them home with to continue the safe, healthy continuation of their healing and recovery?
Yeah. So when you're discharged from the hospital, you're going to get a detailed printed instructions that were created by your physician during your stay. The best thing about all these EMRs now and everything, that it's printed out in legible, computer print, not handwritten scribble that you can't make out anymore. So you're going to have the patient.
I remember that.
Did the pharmacists remember those days when scripts were all handwritten and you couldn't read what they said?
Yeah.
So you're going to have all that stuff legibly for easy to read. So you're going to have your activity, medications to start, medications that you should stop, or medications you continue clearly labeled. What follow-up appointments to make with what doctors should be on there, any additional tests that you may need in the next couple weeks after discharge. If you're discharged on Coumadin, you're going to need to have some Coumadin testing here and there to make sure that your levels are okay. So those will all be on your instructions. Signs and symptoms to monitor at home. If you had surgery, you're going to have some wound care instructions, and there are also instructions when to call your physician if you are having issues, so you know what's normal and what's not normal as far as your recovery process.
Oh, that's pretty slick. I can remember seeing him in the hospital a couple of times. I can remember seeing a little piece of paper,
right,
and a couple of things written on it. They got to do, and I don't even know what this says. So we had to call the hospital. Oh, can't find the doctor. He's gone. All this sort of thing.
Right.
But that was a long time ago. So anyway,
it's all on the computer now.
Yes, for sure.
Just got to find it.
Yeah, right. Or make it work.
Right.
All right, Dan, how can our listeners get more information about patient safety?
Well, I encourage everyone to be a smart consumer. So the government runs a website called Hospital Compare, or there's a Leapfrog Safety Grade website out there as well that have easy-to-understand consumer information on how they rate our local hospitals for patient safety. So they look at readmissions, they look at hospital-acquired infections, success rates. So all that information is right there at everyone's fingertips, and it's very easy to use and navigate, and gives you some great information about the choices you have in today's healthcare.
Okay. Is there anything that we discussed today that we missed, or you just want to reiterate as we wrap up today, Dan, and leave a nice message with our listeners?
Well, I do. I need to give a shameless plug. So today is March 19th, and it's Certified Nurses Day. So the Cleveland Clinic Mercy Hospital wants to recognize all the nurses that create a unique contribution to being certified. Certification benefits patients and their families. Validating the nurses caring for them has demonstrated experience, knowledge, and special skills in complex patient care. So we're celebrating today as a way to ensure high standards of patient care and safety. So that's today. So I'm really excited to say we have over 140 certified nurses in the hospital. We're working on getting more, and that's a national certification that they're studying for, taking tests for, to really take care of that inpatient while they're here and the complex care that a patient requires in today's world. So the last 12 months have really been difficult with healthcare. As you know, it's been hard to navigate. So I appreciate the opportunity to speak today on patient safety, and thank you guys as well for maintaining the pharmacy's high standards and providing care for a community during the pandemic. I don't think we've ever guessed this would happen this way 12 months ago, that we'd still be talking about it and still be going on. But here we are, and it's good to talk about. I hope we're on the downslope now. But thank you for everything you guys do as well there, keeping our patients safe.
Mercy Medical Center, now known as Cleveland Clinic Mercy Medical Center, has been a sponsor of this program ever since the beginning. And they've provided us with a lot of guests, and we learned an awful lot about healthcare and that sort of thing. So we really appreciate that. So Thank you to our guest, Dan Lane, Director of Nursing Practice and Quality Risk Management Director at Cleveland Clinic Mercy Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital and Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. And as always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.